A single daily pill, silently shrinking your brain in just 3 months, not years. This isn't a nightmare. It's the reality for millions of seniors relying on common medications for allergies, sleep, anxiety, or blood pressure. These are pills that seniors take regularly, thinking they are harmless. But a growing body of research is revealing a disturbing truth. Some of these everyday medications might be silently causing memory loss, confusion, and even dementia, long before anyone realizes what's happening. In fact, a recent review uncovered that several medications widely prescribed to seniors can increase the risk of dementia by as much as 80%. What's worse, many of these drugs are still considered safe by doctors, and they continue to be prescribed without much concern. In this video, we'll take a deep dive into 9 medications that are linked to cognitive decline. We'll talk about how they can affect your brain, why they are still being prescribed, and most importantly, what you can do to protect yourself and your loved ones. If you or someone you know takes any of these medications, this information could be life-changing. Oh, and before we dive in, where are you watching from? Drop your city in the comments below. I love seeing where you're all tuning in from. New York, Tokyo, Sydney, or maybe a tiny town I've never heard of. Either way, let me know. And hey, if you're enjoying this already, go ahead and hit that like button and subscribe so you don't miss a thing. Let's keep this going. Number 1. Opioids. Common opioids include oxycodone, OxyContin, hydrocodone, Vicodin, morphine, fentanyl, and codeine. These medications are often prescribed for pain relief after surgeries, injuries, or for chronic pain management. Let's consider Margaret, a 72-year-old woman who was prescribed oxycodone after a knee replacement. Initially, it helped with the pain. But as time went on, Margaret kept refilling the prescription. She started to feel foggy, confused, and forgetful. Once, she even asked her husband why her bed was floating. She didn't recognize familiar faces at times and began to zone out in the middle of conversations. Her husband, noticing these changes, got concerned but assumed it was part of aging. But after 3 years, Margaret was diagnosed with early-onset dementia. Research shows that long-term opioid use can speed up cognitive decline by as much as 40%. These medications suppress the brain's reward and memory centers, and over time, they disrupt white matter in the brain, leading to slower thinking, emotional numbness, and gaps in memory. The scariest part? This damage often goes unnoticed until it's too late. If you or a loved one is prescribed opioids for pain relief, be mindful of the potential side effects. While opioids can be effective for short-term pain, it's essential to discuss long-term use with your doctor. If you're worried about cognitive decline, ask about alternative pain management methods like physical therapy or non-addictive medications that don't carry the same risks to your brain. Number 2. Benzodiazepines. Common medications in this category include diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, and clonazepam, Klonopin. These medications are typically prescribed for anxiety, sleep disorders, and sometimes even for seizures. Let's take Ron, 69, who had trouble sleeping after his wife passed away. His doctor prescribed lorazepam to help him sleep. It worked initially, but soon Ron started doing odd things like digging through the trash or putting empty yogurt containers in the freezer. At first, his daughter chalked it up to grief, but then Ron left his car running in the driveway overnight, twice in 1 week. 3 years later, he was diagnosed with moderate-stage dementia. Research shows that benzodiazepines can increase dementia risk by 32% to 80%. These medications suppress brain activity to reduce anxiety and help with sleep. However, when taken long-term, they can affect memory, mental clarity, and even lead to neuron shrinkage. The scariest part is that they are often prescribed to seniors for years with little to no warning about the long-term cognitive effects. If you or someone you know is prescribed benzodiazepines for anxiety or sleep, consider alternative therapies. Cognitive behavioral therapy, CBT, is a proven method for managing anxiety without medications. For sleep, there are lifestyle changes, like reducing caffeine intake and improving sleep hygiene, that can help without the risk of cognitive decline. Always check with your doctor if you're concerned about the long-term effects of these medications. Number 3, muscle relaxants. Common medications in this category include cyclobenzaprine, Flexeril, carisoprodol, Soma, and methocarbamol, Robaxin. These drugs are commonly used to relax muscles and alleviate pain from injuries or chronic conditions. Consider Helen, 73, who was prescribed cyclobenzaprine for neck pain. Not long after, her family started noticing odd behavior. She once poured milk into a shoe, confused the pantry with the bathroom, and even asked if her grandson's toy dinosaur was the president. At first, they laughed it off as forgetfulness, but it soon became clear that something was seriously wrong. Helen was eventually diagnosed with early-stage vascular dementia. Studies show that long-term muscle relaxant use increases dementia risk by 36%. These drugs can slow brain activity and dull mental alertness, especially in seniors. Over time, they dumb down the brain's ability to process information, leading to confusion and memory problems. For seniors who rely on muscle relaxants, it's important to explore alternatives. Regular physical therapy, stretching exercises, and even meditation can help manage pain and prevent muscle stiffness without relying on drugs that can negatively affect brain health. Speak to your healthcare provider about safer alternatives. Number 4, first-generation antihistamines. First-generation antihistamines include medications like Benadryl, chlortrimeton, and Atarax, which are often used to treat allergies and insomnia. Take George, a 71-year-old man who took Benadryl every night for his allergies. Initially, he didn't think much of it. It was just a common medication. But over time, George's memory began to slip. He started asking the same questions repeatedly, and once left his purse in the freezer. 2 years later, he got lost while driving to his church. Long-term use of these first-generation antihistamines has been linked to an increased risk of dementia by up to 54%. These drugs block acetylcholine, a vital neurotransmitter responsible for memory and learning. In older adults, this suppression accelerates cognitive decline. If you take antihistamines regularly, especially for sleep, it's crucial to be aware of the long-term risks. Instead of relying on over-the-counter medications, consider natural remedies like herbal teas, chamomile or valerian root, or even try a saline nasal spray to alleviate allergy symptoms. If medication is necessary, ask your doctor about newer, non-sedating antihistamines that won't affect your brain. Number 5, sleep medications. Medications like Ambien, Lunesta, and Restoril are often used to help seniors sleep. Janet, 69, had trouble sleeping and was prescribed Zolpidem for her insomnia. But soon her family noticed she was waking up confused and wandering the house at night. She started mixing up family members' names and even used a fork as a hairbrush. A 2019 study found that seniors who use sleep medications several times a week are at a significantly higher risk of developing dementia. These medications interfere with the brain's ability to enter restorative sleep cycles. Over time, they disrupt brain waves, which leads to cognitive decline and accelerates neurodegeneration. If you are using sleep medications, consider non-drug alternatives for managing insomnia. Techniques like relaxation exercises, mindfulness, and a consistent sleep schedule can improve sleep quality without the harmful cognitive effects. Also, consult your doctor about tapering off sleep medications to allow your brain to repair itself. Some medications can indeed save lives, but others might be slowly stealing your mind before you even realize it. Seniors often don't know the risks these medications pose to their cognitive health, which is why it's critical to ask your doctor, is this still safe for my brain? Remember, if cognitive decline has already set in, stopping the medication may not fully reverse the damage. But early recognition of the risks can slow down further damage and, in some cases, improve mental clarity. Take control of your health, ask questions, and don't be afraid to explore alternative treatments that don't come with the same risks. What are your thoughts? Dive deeper into the topic in the next video to learn more tips that could transform your health. Thanks for watching, and we'll see you soon.